Good morning, Ms. Kathomi. First of all, I would like to thank you for joining me in this online meeting. As you know that I am working in community health organization where I work with voluntary and involuntary clients in complex family situations. So last week our organization has organized men's health program where I met a client named Tony and his wife Sonia. So in this presentation, I will be discussing the case scenario of Tony and Sonia with you through my PowerPoint slides. So here are the purposes of this assessment. Firstly, I will be identifying and focusing on the issues of Tony in particular and his wife Sonia, which are impacting them to lead a good life. Secondly, I will be using trauma-informed approach to assess and consider the issues of my primary client, Tony. Lastly, I will propose an intervention plan by using solution-focused approach and by applying my knowledge while demonstrating the critical reflection skills. Moving on to the next slide. Here I'm using genogram, which I derived from systems theory, to brief about the family relations of Tony and also to elaborate the family history of trauma and disease. So beginning from the paternal family, Tony's father committed suicide when Tony was just 25 years old. Tony is now 46 years old and he is addicted to alcohol. He is also experiencing chest pain. On the other hand, Sonia is Tony's wife. She is 45 years old and her parents got divorced. She has a sister Janet, but they hardly meet with each other. Both Tony and Sonia have two children, Henry, who is 22 years old boy and is diagnosed with schizophrenia, and their daughter Eve, who is 19 years old and she is also facing difficulties due to being overweight. She is also suffering from headaches and stomach problem. So from this genogram, I can conclude that Tony has family history of depression. My next slide is clients involved. So in the given case scenario, my primary and involuntary client is Tony, who is reluctant to take any kind of help from external sources. And my voluntary client is Sonia. She is a great supporter of Tony and as she has convinced Tony to come to men's health program. Moving on to the next slide is working with involuntary clients. So before doing the assessment of Tony's issues, I'm going to explain that how difficult it is to work with involuntary clients and the challenges that we face as social workers when we deal with such clients. Firstly, the involuntary clients are very tough as they are reluctant to take any kind of help, and most importantly, they do not trust social or external services available to them. For example, if we look into the case of Tony, I think that he is not ready to talk about his health condition. And also, he is not ready to quit his alcohol habit because he believes that alcohol acts as a stress buster for him. So, according to me, the main reason for denying help is Tony's lack of trust on the social services. And while dealing with such client, it is very important to build trust with them. So, even a slight response from such clients can work as a big hope for us. Moving on to the next slide is the assessment of Tony's issues. So, going to the point of the issues of my involuntary client Tony, some of the issues which I feel prominent to be addressed are firstly, the family history of depression. As Tony's father also committed suicide when Tony was young, so and Tony is also experiencing chest pain, but still not ready to give up his drinking habit because of his belief that alcohol relieves his stress. Another aspect is the family. Whereas wife also has anxiety issues and migraines, his son is diagnosed with schizophrenia, which is the root cause of family problem as it is causing trouble in the family. So handling Henry in such situation is tough, and this is impacting Eve life as well, as she is also under the threat of depression. So we can see that all these problems are revolving around Tony, and this has caused the isolation of the family from friends and relatives. So they hardly get any chance to enjoy and celebrate with each other. So I believe that this is also a prominent issue in Tony's life as he has limited himself in terms of his life. So this can be the reason of him being reluctant to share anything with anyone and to seek any kind of help. My next slide is areas of intervention. So after discussing issues prevalent in Tony's life, now I'm being specific to where I'm going to intervene. So firstly, I'm concerned about deteriorating health condition of Tony because of his drinking habit and family history of depression. Secondly, I will be using Sonia as a supporter of Tony as she is a disability support worker. So I believe that I can make use of her knowledge and skills as a benefit to this case scenario. So I think that by guiding Sonia, I can actually help Tony to find other ways to change his family condition and also help him to live a happy life. Moving on to the next slide is intervention approaches. So keeping in mind the issues of Tony and Sonia as the porter of him, I will be using two approaches to intervene, that is trauma-informed approach and solution-focused approach. Trauma-informed approach. So firstly, it is very important to understand the approach that I am using in this case scenario. So the trauma-informed approach in the modern times is used to move away from thinking that the medical conditions are the result of the client's current situation. So we reframe our mind to think that something traumatic is experienced by the client, which can be physical and psychological injury. So this traumatic experience of the client is the main reason for his current situation. Traumatic informed practice has basic principles which includes safety, trust, choice, collaboration and empowerment. So the first principle is the safety, which is very prominent for the client with traumatic experience, and the social services are needed to give a safe physical environment and safe relationship with the client and the provider. Secondly, now trust building is used to create an earliest relationship with the client, as without trust, the subsequent developmental task of initiative, competence, and intimacy will be compromised. Moving further, choice is vital because it is important to involve client in decision making and giving the client a choice. Next is collaboration. So collaboration is used to give a shared power between the social worker and the client. Lastly, empowerment. So this is used to remove powerlessness of client which they have because of the traumatic experiences they have faced earlier. Moving on to the next slide, now I'm going to explain that how trauma-informed approach can be beneficial and used in the case of Tony. So firstly, trauma-informed approach can be beneficial for Tony as the trauma of the suicide of his father and history of depression has an impact on his life as well. So through this approach, I can work with the perspective of the psychological impact of his father's suicide on Tony rather than just thinking only about his chest pain and alcohol addiction. Secondly, it can help in creating a safe environment for Tony that enable trust, collaboration, choice, and empowerment across the treatment. As trauma-informed approach creates a safe environment for the client and help in building trust in the client by collaboration and empowering the client, therefore, it can be of great importance in this case scenario. Lastly, as Tony is an involuntary client, so trust through this approach can be built effectively and Tony can experience healthy relationship with others. So this will also enable me to listen effectively to Tony and I will also be able to understand that what Tony actually feels about his current condition. So I think that this approach can work efficiently with Tony and by empowering Tony through the approach, I can make him to be a part of the decision making process for himself. So after I create a positive client and worker relationship by actively listening to him, I think I can also share with him the options that can help him. So through this, he can select that what is more important to him and for his family members. Moving on to the next slide, as I have discussed earlier that I'm not only using trauma-based approach, but also another approach which I think is relevant in the case scenario of Tony. after the assessment of the given case. So another one is solution focused approach. Firstly, the solution focused brief therapy is a goal oriented approach which focuses on what the client wants to achieve. So this means that rather than thinking about the negatives, we need to think about the positives in life of the client through what he or she wants in his or her life to be like after receiving the therapy. Secondly, this approach not only focuses on the present but also focuses on the future by looking at the possible solutions. So, again, this theory provides the solutions which can only be achieved by thinking of what kind of changes can be brought in client's life so that he or she can survive happily. Another one is the already available resources of client works as the basis for the ongoing change. So this means that the already available resources that are with the client in the current scenario will be the base for providing a solution to the client. Lastly, both worker and client are observed as partners in the change process. So the client works in collaboration with the workers, which I think is in trauma approach as well. So this will be beneficial for my client in the given case scenario. Moving on to the next slide. Now I'm going to explain that how solution focus approach is appropriate in case of Tony and Sonia and how it can help me to handle the situation with my involuntary client Tony in the given case. So firstly, working with involuntary client is an extreme challenge for social workers and especially the alcohol abusers, which is the case of Tony. So as Tony is reluctant to share his issues, so I think this can be an issue for me as well. In the given case scenario, the solution focus approach is most appropriate as involuntary clients need to have trust on the services. So I believe that Tony reluctance can be handled by trust process, and even if I get 1% of Tony's trust through the process, then further things in therapy can be achieved effectively. The next one is solution focused approach also works by creating a client and social worker partnership. So a positive partnership and collaboration by maintaining professional boundaries with the client can be extremely helpful to understand the perspective of the client, which I can achieve using the solution focused approach. So this type of approach increases engagement of the client in the process, and even a little engagement from a reluctant client can be of a great help. So my next slide is implementing solution focused therapy. So now I'm here explaining about how will I actually implement or initiate the implementation of the solution focused approach in the case of Tony and Sonia. So to begin with, I will here to encourage Tony. The appropriate strategy is to find the positive in his life, which is his wife Sonia, which I believe is appropriate as per the approach, as this will guide me to find solutions for my client Tony rather than just thinking about his problems in his life and in his family. So the next one is as Tony is not ready to join the men's health program, but was convinced by his wife to join the men's health program, which is a positive sign and shows a scope for involvement and change. So this also shows that Tony wants to solve problems, but is not ready due to trust issues on the social services. So the next one is Tony's wife Sonia is a disability support worker, which can help Tony to understand the situation in a better way. So I think this is the best part of the case, as Sonia convinced Tony to join men's health program. So for me, it can be really great to guide Sonia and help Tony to come out of the current situation through the support of his wife as well as social services. Next one is even after facing difficulties and health issues, Tony is not leaving job and describes himself as a hard-working person. So this really shows the determination and responsibility of Tony towards his family that he is continuing his job. Lastly, Tony also wants his wife not to leave her work for family issues, which shows his supportive attitude for his wife Sonia. So I believe this is a very positive sign as it seems that Tony is really supportive of his wife and her career. He just thinks that she's being overprotective and need not to leave her job for family problems. Moving on to the next slide is intervention strategies using approaches. So now moving on to my plan of intervening through the approaches in Tony and Sonia case, I will follow a combination of solution focused and trauma based approach to handle the situation and to build trust on Tony. First, firstly, focusing on positives. So my first focus is on the positives of Tony, which are explained in the last slide, which will help me to establish a positive foundation for Tony to help him as an involuntary client. Next is exception time. Now, focusing on the exceptions, my area of intervention will be finding the time when Tony is not finding any kind of problem. For example, when he is on the job, as he describes that he works hard. Next is miracle questions. So through this approach, I will be including miracle questions for Tony, such as imagine one morning you wake up and all your problems are solved. So this will provide him a positive side and made him to feel changed life when problems are solved. Next one is exception questions. So I will also include exception questions such as tell me about the time you felt extremely happy or explain to me regarding the difference in times when problems are better. So these kinds of questions will divert his mind from the negative things in his life and he will start thinking about the good things in his life. Next is scaling questions. So I will also include scaling questions for Tony, which will be most easier and he can perceive his problems on continuum. For example, scaling from 0 to 10 with questions such as on a scale of 0 to 10, rate your happiness in current situation or rate your family bonding. So I will be getting an idea through asking scaling questions that how Tony feels his life is currently like, and I can further think about how to work on those things. The next one is referral services. So I will also recommend some of the referral services to Tony, such as I will encourage him to see a psychiatrist for his depression, a general practitioner so that he can get treatment for his chest pain on a regular basis. Apart from this, I will also recommend him to go to de-addiction and rehabilitation center so that he can quit his alcohol habit. So I believe that all of these referral services will be useful and helpful to improve the overall well-being of Tony. Lastly, using Sonia as supporter. So I'm thinking to use knowledge and skill of Sonia to support Tony, and I will guide her on how to help Tony to leave alcohol addiction and also how to live life happily. I will also collaborate with Tony to dissociate with his trauma using trauma informed approach as well as through the help of Sonia. So my next slide is justification of solution focused theory. So here I'm going to explain that why solution focused theory is relevant in this given case scenario. So firstly, this therapy is appropriate in case of Tony and Sonia as the solution focused approach assumes that the client wants the change. Secondly, it rejects the perspective of deeply ingrained pathology. Next, it can also help Tony and his family to believe that thinking and facing difficulties are two different aspects. For example, a small change in the family, if noticed, then can help Tony to create bigger changes in the future. Another aspect can be finding the exceptions where Tony is provided with the time when problems have not been present. Lastly, miracle questions. This will also work in a positive manner for the family as they can see the positive side of their life. Moving on to the next slide. So here are the references which I have used for this case scenario. Well, after undertaking the assessment of the issues which are prevalent in Tony's life, I believe that the intervention plan which I have made using trauma informed approach and solution focused approach will actually help Tony to resolve his issues with the support available to him. And it will also help him to live his life in a better way with his family members. However, I would also like to welcome your suggestions and guidance in this aspect so that I can further proceed with this case. Thank you so much.